When we see shattered glass like this in a movie, it usually means we're about to meet a dangerous, unpredictable villain with dissociative identity disorder. Pop culture has spent decades turning a complex psychiatric diagnosis into a cheap plot twist, leaving us with a totally distorted view of what it actually is. In reality, people living with this condition do not pose a threat to the public, and they aren't hiding a cinematic monster inside. Instead, we're looking at an incredibly resilient biological response, a tragic but highly effective way the human brain keeps itself alive. To understand why a mind fractures, we have to ignore the Hollywood tropes and look directly at the intense conditions that force it to adapt. The clinical truth is that dissociative identity disorder is almost exclusively rooted in severe, repeated trauma experienced during early childhood. Imagine a young, developing brain trapped in an environment of continuous abuse, where physical or emotional escape is completely impossible. This diagram of a unified sphere represents the mind. To survive, the child erects absolute mental barriers, effectively walling off the agonizing reality of the abuse into its own isolated section. This internal escape hatch absorbs the psychological shock, protecting the rest of the consciousness so the child can still go to school and manage daily life. When a person cannot physically run away, the brain defaults to its ultimate biological imperative, breaking itself apart to endure what no child should ever have to. Because the mind has walled off those experiences, the external result is the first major clinical marker of DID, the presence of two or more distinct identity states. We can visualize this with a network diagram. The unified system cleanly splits into separate nodes, representing different identities that hold specific memories, emotional capacities, or coping skills, all running on the same biological hardware. As you watch these nodes shift control, notice how the previous one goes completely dark. That represents the second major clinical marker, severe amnesia. These gaps in everyday memory happen because different identity states are taking the wheel to keep the person insulated from the walled-off trauma. The brain is doing exactly what it was forced to do. It is absorbing unmanageable shock. Far from being an unpredictable defect, these symptoms prove the existence of a highly organized neurological shield built to keep a human being alive. Because we know this is an adaptive survival tactic, there is a deeply encouraging reality. A fractured mind can heal. There isn't a single pill that can resolve it. Recovery requires a rigorous, carefully phased approach through trauma-focused psychotherapy. This timeline breaks down the process. Step 1 locks in, establishing psychological safety. This generates a stabilizing wave to manage daily functions. Finally, the wave reaches integration. The distinct shapes collapse into a single sphere, safely merging into one unified self. It is a gradual, incredibly brave process of safely taking down the defensive walls that the patient no longer needs to survive. Navigating a system this complex means diagnosis and integration must be guided by a licensed clinician with deep experience in severe trauma. That is where Coping and Healing Counseling, or CHC, comes in. They have a culturally competent team of over 15 licensed therapists trained specifically for this kind of care. As you can see on this map, CHC is entirely digital. They provide 100% telehealth, HIPAA-compliant therapy, covering all 159 counties in Georgia, allowing patients to heal from the safety of their own homes. Care is also highly accessible financially. Medicaid patients pay a $0 copay, and those with major insurances average just $10 to $40 per session. You can start the process by visiting chctherapy.com or calling 404-832-0102. Reclaiming a life from the trauma of the past takes immense courage, but it is a journey no one has to undertake alone.